I'm Carolyn Zaumeyer, nurse practitioner, and the title of my talk today is, Are You Tired of Being Tired? I hear it all the time. The way I came up with that name of that title is that many people, the number one reason they come see me is a fatigue. That's their number one complaint. They're just tired of being tired, especially towards the end of the day where they just don't feel like doing anything, like going out or having fun. So I am Carolyn Zaumeyer, nurse practitioner. I own my practice as Low TE Florida. I'm connected with the Forever Health Network, which is Suzanne Summers' organization, where she kind of vets the practitioners to make sure that we're doing things the way she approves of. So I got the seal of approval, and Suzanne and I are buds, so it's all good. So how did I get here? I became a nurse because my great-aunt Edna, she was a nurse back in the 1920s. She graduated college in Chicago, hopped in a Model T Ford with her friend, went to California to become nurses to the stars, and boy, did she do it. She used to come to the farm where I grew up in California. She told me all these great stories about what it was like to be a nurse. So ever since I was little, there was never any question as to what I was going to do when I grew up. So she had her brushes with greatness, and she'd tell me all these stories about the movie stars. And she, even had the pleasure of taking care of Clark Gable during his last years. And I was in love with Clark Gable after Gone with the Wind. So that was a good one. So I've had my little brushes with greatness with my nursing career. I've had the privilege of working with Suzanne Summers. We've done a couple interviews together. They're on my website, lowteflorida.com. And then I also had the privilege of meeting Dr. Oz. I was trying to convince him there to have me on his show. I'm still waiting by the phone. Haven't gotten that call yet. It'll happen. Anyway, I was trained here in Florida. I started at Broward Community College, transferred to Miami-Dade Community College when I was lucky enough to procure a position on the University of Miami's transplant team. So I worked my way through school delivering kidneys all throughout the country. I then transferred to FIU for my bachelor's, my nurse practitioners, and then finally my master's degree program. I have taught at FIU, and I've also taught at FAU, and most recently at Duke University in North Carolina. So I've been prescribing hormones for over 28 years, and I have found the answer to this fatigue is balancing your hormones. So if you're tired of being tired, open your mind and hear what we have to say today to see if maybe this is right for you. So what I've learned over the years, I started out when I first graduated from school working with a physician, and I was sharing a desk because I was like a little sponge. I didn't know enough. And so I kept reading his charts. And for the menopausal women, he kept writing psych referral, psych referral, psych referral. Finally, I went to him with a stack of charts and I said, listen, all these ladies can't be crazy. And he said, oh, yes, they are. They're screaming, they're crying, they're sweaty, their relationships are a mess. They need to get their lives together. And I said, can I have those patients? And he said, God bless you, go forward. I'll go deliver babies. You take care of the old birds. Perfect. I'll take care of these ladies. So what I've learned, I started off, I was writing for synthetic hormones because that's all we had back then, Premarin and Provera. And then in 2002, there was this big, huge study that was nationwide, and it had thousands of women in it. It was called the Women's Health Initiative. And what the early studies were showing is that how bad synthetic hormones were, causing deep vein thrombosis, stroke, heart attack, Alzheimer's, and even breast cancer. So that got on the newspapers. Over 80% of the women in the United States came off their hormones. I'm surprised we didn't have a civil war. I mean, women off their hormones, it's not good. But with that, it drew me to go study about bioidentical hormones. And they don't teach it in school, not in medical school or nursing school. You have to go out and study it. So I searched out the nation's greats, went over to Salt Lake City, studied under Dr. Neil Rousier. Brilliant, really brought home not only the feel-good effects of hormones, but the safety of it and the health benefits. So I was all excited, but when I got home, I realized he didn't teach me how to dose. And so I didn't know how much of the creams I was supposed to be telling people to rub in. Same thing when I went and studied in Orlando, again in Naples, and I was just frustrated. I thought, I'm not even going to do these bioidenticals because I want to be able to treat my patients properly and not hurt anybody. So finally, I was complaining to a friend of mine, a doctor in Utah, and he says, you have to go to Texas and study under Dr. Gary Donovitz. So I went off to Texas and I studied under Dr. Gary Donovitz, and it all came together. And he taught me how to dose patients individually, safely. So we're giving the right hormone, the right delivery system, and the right amount of hormone. He actually wrote this book that is available on my website for free. age healthier, live happier. If you want to go to my website, there's a place where you input your information and we'll mail it to you. The website is lowteflorida, spelled out.com. But anyway, what are hormones? Let's get back to that, get back to the science. Hormones are chemicals that are made by the glands when women, mostly in the ovaries and men in the testes, and we secrete them as we're aging, and then it gets less and less. But the hormones work like in a lock and key throughout the body, fitting into the receptor sites on the cells. We tend to think of the hormones as sex hormones, but they're really multi-system. We have receptor sites that'll affect our brain, our breast, our bones. So it really is interesting that when we bring the hormones back into the body, how well your body functions with these hormones that we need. So what is a bioidentical hormone? Bio means it's from biology. We have, it's derived from wild yams. And identical is the chemical molecule in our product is exactly the same as what your body used to produce. So it fits into those receptor sites just like a lock and key, where I picture the synthetics like a square peg going in a round hole. So how do you feel? What drew you to push the button to sign up to come in to see this talk today? Little, not yourself, maybe a little cranky, irritable, maybe feeling like you're gaining a little weight, especially around the middle, maybe some headaches, hot flashes, night sweats. These are some of the things that both men and women will notice when their hormones start to decline naturally with age. That extreme fatigue, 3, 4 o'clock hit the wall. For me, it was I was able to work through my day. I was working really hard, but by the time I got home, I didn't want to go out. I didn't want to do anything. I just wanted to feed and walk my dogs, put my jammies on, pour a mug of wine, and hit the couch. I was just done. And then I realized after I'd received my pellet and gotten treated, that I wanted to go out. I was doing the little things on the list of things I like to do at home, like cleaning the garage and painting the baseboards. So that's what a big difference it was for me. Mood swings, you feel more level. Anxiety and depression kinds of decreases. Tension and irritability, you're not quite so snappy. Lack of sleep, who's waking up at 3, 4 in the morning and then you can't get back to sleep? Testosterone helps you sleep, it's nice. Memory loss, why'd I go in the kitchen? Where are my keys? Depression, just not feeling as happy as you used to. You don't have that spring in your step. Lose your lack of focus. I have one patient that says that's one of the key things that he notices when he needs his pellet is that he loses his focus at work. He's thinking, trying to do a project and his mind keeps drifting from here to there. And then he says, once he gets treated with my pellet system, he loses his brain fog. He's thinking clearer. He feels like his wheels are turning quicker. And then hot flashes, you've heard of this. Women have these fireballs, these hot flashes, where they're just, all of a sudden they'll be sweaty and hot and really not happy. And night sweats can be for both men and women, where you wake up in a little pool of sweat and you're going to have a disrupted sleep. And without a good night's sleep, it's hard to have a good day. Weight gain, especially around the middle. It seems like after 50, everything wants to turn into fat and hang around our middles, and it doesn't want to go away. Joint pain. A lot of people say that once we optimize our hormones, our joint pain is relieved. Migraine headaches, bladder symptoms, mild urinary incontinence for women. I have one patient that knows that's her trigger, that she knows she needs to come in to get treated again. And a decreased sex drive and a performance. Things aren't working the way they used to. You don't think about it as much. It's just kind of the last thing on your list of things to do for the day. And that's not good because you need to have the intimacy in your relationship. It's kind of like the glue. So if any of those sound familiar, we may have the answer for you. Estrogen is present in both men and women, large amounts in women, very small in men, has over 400 functions in the body, controls the hot flashes, maintains bone density, and helps with your memory, helps with your collagen in your skin. I can tell who's had the benefit of estrogen as they age when the ladies get older and those that haven't. The ones with that real thin, friable skin that looks like you could tear it with your finger haven't had the benefits of estrogen as they were aging. It also helps give you happy feelings. You may be crying over silly stuff. This balances you out, with the emotional part of it. Positive effects of natural testosterone for both men and women include increased energy, vitality, and zest for life. You get that spring in your step, feel like you did maybe 10, 15 years ago. Improved feeling of overall well-being, depression relief, anxiety relief, improved thinking, clarity, memory and focus, prostate protection for men, breast protection for women. There's this researcher in Ohio, Dr. Rebecca Glazier, that's doing these great studies on testosterone pellets and breast cancer. And her latest studies are showing that women that optimize their hormones with testosterone pellets have up to a 40% decreased risk of breast cancer. That's crazy good. Cardiovascular protection helps prevent cardiac disease. Increased bone strength. Testosterone actually lays down bone, can help reverse osteopenia, make osteoporosis not come back to normal. It increases muscle strength. Without testosterone, it's impossible to build muscle. You may be lifting weights all day, all night, but you're not going to build anything. You may be able to maintain what you have and tone what you have, but you're not going to be able to build anything. So it's nice to see people getting their physique back. Reduced body fat. Testosterone is a leaning out hormone. If you think of when men's testosterone was the highest, it was their late teens, early 20s. And with that, they're long and lean. Most of them don't have that belly fat that we tend to get after 50. So it also helps lower the cholesterol. I have 2 patients in particular I can think about that their primary care provider doesn't understand why their cholesterol numbers are coming pretty good. Enhanced libido, you think about sex a little bit more, and when you do have relations, it's like the fireworks are brighter. And enhanced performance, things work better down there. You get a better blood flow, things are just kind of woken up a little bit. And improve sleep. Most of my patients, when we optimize their hormones, say that they get a nice, delicious sleep, waking up feeling more refreshed and feel more like exercising. So testosterone, besides providing major symptom relief, it protects the bones, the brain, the breast, the heart, the joints, and relationships. It's present in both men and women, large amounts in men, small in women. Men age 30 to 70 will lose 1 to 3% of their total testosterone production per year, where women age 20 to 40, look how young, lose 50% of their testosterone production. I've had young ladies like 35 years old come in and say, I don't understand it. I've got a great life. I've got a great husband, a nice house, a great job, good kids, the whole thing, but I don't have that loving feeling. I don't have that chemical feeling, that desire. And I'll test her blood, and her testosterone will be so low that you can't measure it. Once we bring it up and optimize it, she comes back in, we test the blood 6 weeks later, and she's like a rock star. She got her life back. She said she likes herself better, her husband likes her better, and her life is just much better. So these are the 7 dwarves of menopause. This is Suzanne Summers. I stole it from her. Itchy, bitchy, sweaty, sleepy, bloated, forgetful, and psycho. And I always think of my original physician that I worked with when we get to the psycho part, because women going through menopause may feel like they're going psycho, but they're not. They just need to have their hormones optimized. Now let's pick on the men for a moment. Andropause, menopause, what a low T, whatever we want to call it. Here we go. He's got a little extra weight there going around the middle. He'd rather sit in his chair, rather have his beer and have the dog on the treadmill instead of him. And you're not going to get that remote away from him because he's stuck to the TV. I had one patient that told me that I performed a miracle in her house. I'm like, really? And she says, yeah, you got my husband out of the chair. I had pelleted him, treated him, optimized his hormones, and he wanted to go out and he was exercising, and it just really turned his life around. So that's nice to hear. So low T in men may find themselves feeling sluggish and tired all the time, gaining weight, losing muscle mass, depressed, irritable, and lacking in sexual desire. So how are these symptoms usually addressed? We self-treat ourselves. We have that extra cappuccino, that espresso. We drink the Red Bull, energy drinks, take a little B12 shot, maybe have a shot of tequila, whatever it is, trying to make ourselves feel better. And it doesn't work. It may give you a quick boom, but that's it. Many doctors don't take your symptoms seriously, and they'll come up with a diagnosis and give you some prescription medications. Right now, what's a gold standard? If you go to your OBGYN ladies and say you have hot flashes during the day, what does traditional medicine prescribe for you? Yep, an antidepressant. Well, great. Were you depressed? No, you were having hot flashes, but you went on an antidepressant. You know what? Some people that aren't depressed get depressed on antidepressants, and they usually get fat. Then what happens? Oh, good. I got a diet pill for you, so we'll just knock that weight right off. Oh, that phentermine just shot my blood pressure up. That's okay. I got a pill for you. Here you go. There you go. That'll take care of the blood pressure. Oh, well, with all this, now your thyroid's whacked. Okay, I got something for you there. And then the corker is you get to take, now that you're still fat, still having hot flashes, high blood pressure, whacked out thyroid, you get to take a statin. So now you get to have muscle aches and pains and possibly an increased risk for breast cancer and just not feel well. So rather than going through this whole prescription thing, how do you want to age? Do you want to age with all this, or do you want to age naturally by optimizing your hormones to take care of this? Hit it at the root of the problem instead of throwing medicine at it. So we use a pellet system at BioTE. Little tiny pellets get inserted under your skin on your backside, and they just gently bring up your hormones over the next 4 to 6 weeks, and then hold you steady. For women, 3 to 5 months. For men, 4 to 6 months. So guys only need to come in like twice a year. So the history of pellets is interesting because we really haven't heard much about them. When I first started doing it here in Florida, I was the first pellet provider for BioTE in Florida. And so it was very foreign to talk about it. People didn't understand what I was talking about. But the pellets have been used safely here in the United States for over 80 years. It's not something newfangled. It's the first study I can find is 1939. I ran into a pellet system in 1979. I was training in surgery in Memphis, and we did a hysterectomy on a woman, closed her up, rolled her over, put the pellets in so that she wouldn't feel so bad when she woke up. So it has been used safely here. The reason you haven't heard about it is because Big Pharma can't patent it. It's natural. It's derived from nature. They can't patent that. They can't put a fancy name on it, do big commercials, and charge you 5 times more. So we have the answer here. If you want to turn back the clock, maybe 10, 15 years, get to feeling like your old self. It just doesn't feel good when we lose ourselves. So the pellets are used all over the world. It's not just here in the United States. So what is BioTE therapy? It helps the body return to its normal hormonal balance and physiological state. It's based on the right hormone, Bioidentical, the right amounts, individualized scientific dosing, not guessing, and the right delivery system, which is a pellet system, the safest way of getting hormones into your body. So how do we personalize your dose? We take your lab values, we take your medical history, we combine that into a computer program, and we'll know exactly what your body would benefit from. So BioTE pellet therapy is safe. Hundreds of studies, since it's been around for 80 years, we've had plenty of time to study it. So we have hundreds of studies, experienced long-term safety record used here in 5 continents and the United States. It's clinically effective. Instead of the roller coaster ride with shots, pills, patches, gels, creams, when you put it on, you get a whole big old rush of hormones. Oh, you feel great. You feel like a rock star. Then it comes down and you feel like crap. Then it goes up, you feel great when you take it again, and then down, up and down. It's a roller coaster ride. Women in menopause do not need a roller coaster. They're on it enough already. What we want to do is bring you up and hold you steady. The pellets last, like I said, for about 3 to 5 months for women and 4 to 6 for men. You'll start to notice some of the good things going away, and that's how you know you're ready for your next dose. We want it to dip down a little bit, but we don't want you to go all the way back where you started, because then you have to build it back up again. So not having the roller coaster is key. With that steady release of the hormones, you also get those health benefits that we talked about. It's convenient. You don't even have to think about it. It's inserted. That's it. Low side effect profile. The best method to increase bone density. No evidence increased risk of breast cancer risk. Does not stimulate breast tissue. That's fabulous. No increase in blood clots, heart attack, and stroke. Remember, that was with the Women's Health Initiative. That was the big thing, was an increase in blood clot, heart attack, and stroke. And that was from the synthetic progestin that they were pairing with the estrogen. So it wasn't really necessarily the estrogen that was causing the problem. It was the synthetic progestin that they had to pair with it for women with their uterus. So the pellet therapy is protective to the breasts, bones, brains, heart, and relationships. So what you need to know, not all hormone therapies are created equal. Hormone replacement therapy is not a one-size-fits-all approach. And we were guessing. Any other method you use, we're guessing at the dose. There's no other program that has a scientific dosing like this. With the creams, people are looking at the labs and saying, okay, I think you need. And usually, back in the day when I was writing Premarin, I would start everybody at the same dose and adjust up or down depending on how they replied, how they responded to it. Well, who didn't even call back that still didn't feel well? I don't know. But That is not good science. It's not good medicine. So I would rather use something that I know works. I have this concrete brain, and I know our dosing site is about 95% of the time spot on. And what we do is we have you come back at 6 weeks where we check your labs and check with your symptoms, see what's relieved, and see if we need to tweak it a little bit. It errs on the conservative side. It's not going to take you over the top where you're having roid rage and beating people up. It's going to be just right in the neighborhood, and then we tweak it from there. So you need an expert, and you got me. I studied more about bioidentical hormones than I think anybody else in the state. The #1 provider for BioTE here in Florida, and I rank up in the top 5 nationwide. I've been doing this a long time. I've pelleted over 8,000 butts. I'm Carolyn Zaumeyer, nurse practitioner, Low TE, Florida, and I hope you come see me. So why choose Low TE, Florida? First provider in Florida. I'm a platinum provider, which is an award I've gotten for my number of procedures and the quality. I've served on the BioTE Medical Advisory Board, and I help mentor nurse practitioners and doctors throughout the country. I rank #1 in Florida, and I'm the top 5 nationally. It depends on the month. So how do you start getting your energy back? Call Low TE Florida to schedule your free virtual consultation. Special consultations, usually we used to charge $150 for the consultation, but we're waiving that for you. The blood draw special tonight, usually it costs $195 if you come to our office for the labs, but we can, if you're watching this and mention it when you schedule, you'll get a discounted price. But you must schedule your appointment before November 30th. So I invite you to please call the office. I want to sit down with you one-on-one to go over, or our consultation will be virtual, but we'll still go one-on-one, and I want to get to know you, your medical history, and see if this is a good treatment for you. Thank you so much. It's nice to see you guys. Bye.